Hello and welcome back. Today's question is, what are the benefits of yoga in pregnancy and postpartum?
This is Jaely Daily, the bi-weekly podcast about all things doula tips and tits, where we answer one question about pregnancy, labor, postpartum, or lactation in order to have your journey in this parenting world be just a little bit more informed and filled with consent.
Hello, welcome to Jaely Daily. I am Jaely Harad, your host, and we are on our second episode of Guests. I need to start saying second because Emrys was my first guest, my 8-year-old. And so Wednesday we had Kim talking about sleep, and today we have Jaely, who obviously by her name, she belongs on our podcast, right? She fits right in. So Jaely Turner is a mom of 2, the owner of Our Village Circle Birth Services. She provides prenatal support to birthing folks in Northern Virginia and DC. In addition to being a certified childbirth educator and doula through Birthing from Within, she's also a trained yoga instructor specializing in the postnatal body and yoga for the pelvic floor, which I'm super excited to dive into that because pelvic floor is one of my favorite topics. She produces and hosts the Our Village Circle podcast, which I really recommend you check out. I've listened to some of her episodes and they're awesome. And the podcast mission is to elevate the voices of parents and professionals alike, to demystify the realities of new parenthood through authentic sharing and honest storytelling. So, Jaely, we are very excited to have you here. And can I just say that it's a little bit weird to say, I feel like I'm saying my name wrong, right? When I say your name.
The same way when I say your name.
Yes. Like every time I say it, I'm like, that's right. It is Jaely. That's how you pronounce it.
I know, we were destined to meet and collaborate on a podcast episode at some point.
Exactly. And I always had seen your name online and wondered if it was pronounced the same, but didn't have the, wherewithal to actually just ask you if we are, but also like when you see a name online, you don't know how it is pronounced. And so, anyway, so welcome. I'm super pumped to have you here because I cannot answer this question. I don't know. I am not a yoga instructor. And so I'd love to just have you dive into that question of what are the benefits, and then we'll just chat.
Sure. So yoga, I came to yoga during my first pregnancy with my son, George, who is now 3.5. And initially it was just as a place to connect with my body, which can be one of the big benefits of prenatal yoga. And I found that there were so many more benefits than just taking an hour for myself. Of course, the biggest one being a place to connect with my body, a place to connect with my mind. This is something that can be really, really important, not only for labor, but also for parenthood.
Yeah.
And especially in that postpartum period.
Yes.
Just being able and having the skills to take a second to check in with your body, with your mind, not necessarily trying to fix anything, just observing what's going on and having that awareness. There's so many changes that happen during pregnancy and especially during postpartum. Your body is changing at lightning speed.
Yes. Moment by moment.
Like literally moment by moment.
Yes.
And it's not even like a appearance and body image thing that I'm talking about. I'm literally talking, our bones are shifting. Our energy centers are shifting. Our center of gravity is shifting, and just having that spatial awareness is so, so important, not only for injury prevention, but how we move throughout the world, how we carry ourselves. It affects our confidence if we're embodied in our own beings and we have an awareness of how our new bodies work. That can be super empowering.
Yes. Yep.
So I would say that was probably the biggest benefit for me and the biggest benefit that I've seen for other people who practice yoga during this time.
Yeah.
I think the biggest thing that's advertised is relief from aches and pains and connecting with your baby.
Mm. And would you say connecting with your baby both in pregnancy and postpartum?
Yeah. I would say not everyone feels connected to their baby during pregnancy.
Right.
You know, if you go to a lot of prenatal yoga classes, often the thing you'll hear is put your hands on your belly, connect with your baby. That can be really difficult for some people. And for some people, they do feel super connected. They're feeling baby move a lot. They're, you know, the baby has a clear personality in the womb, and they're making it known. But for some people, it's just the changes are so abrupt. So much is happening. They might feel so sick. They might have so many aches and pains, especially if they're suffering from something like symphysis pubis dysfunction or something like that. It could take all of their energy just to deal with those things that the bandwidth just isn't there to connect with baby. But if you can connect with your own body, that's a wonderful starting point.
Yep. Do you see then that people benefit from the practice of yoga most if they've done it throughout pregnancy and then postpartum? Or what if, like, in postpartum, someone's picking it up for the first time? Obviously not in the earliest days, you know, but do you see them? I mean, yeah, you can answer that question however you'd like, but what would be the most beneficial, I guess?
I think that it's beneficial at any starting point, to be honest. You know, coming into the practice is better than not. But of course, you probably would experience the most comprehensive benefit starting even before pregnancy. Like for fertility, it can be extremely beneficial as well. But I think that it can be particularly beneficial in the postpartum period.
Okay.
Because although those body changes are happening so gradually throughout pregnancy, from pregnancy to not pregnancy, it is just such an abrupt and sudden disruption to the body, to the body's energy field, to the hormonal balance, to the center of gravity, to everything. And not to mention the disruption to your routine, the disruption to your sleep and everything like that. You know, you see a lot advertised like mommy and me yoga classes. I highly recommend, if anyone, that can be really beneficial if you're looking for an activity to do together with your baby. I would recommend that folks seek out, if they're looking for something more geared toward reconnection with the body and rebuilding, to seek out a specifically postnatal yoga class. You can bring your baby, but the focus is going to be more centered on the birthing person.
Yeah. I think that's so important in the postpartum time too, because so much focus is on the baby after birth. And so you're just kind of like get grouped in as a pair, or it's just all about the baby, you know? So having some things that are just about you is so important.
Yeah.
So talk to me about what yoga for the pelvic floor even is. And how did you get into that specifically?
Yeah. So actually, yoga was a very big part of me coming into birth work.
Okay.
It was my starting point. I still do, but I worked primarily as a professional opera singer prior to COVID. And after I had my first son, that was when I did my yoga teacher training. I went through a really, really rough postpartum with my first. And yoga was a very, very big part of me reconnecting to myself and reconnecting to my body. And when I did my yoga teacher training, I was just coming out of the fog of very severe postpartum OCD, OCD and PTSD. And it was instrumental in my recovery. And during my yoga teacher training, I remember thinking that it was really a pathway to me helping out the perinatal community in some way. And I didn't really know what that was yet. That yoga teacher training then ultimately led to me taking a pelvic floor yoga teacher training, which then led to me training as a doula. COVID hit. I lost my job as a singer. And I always had said, when I retire from singing, I'll be a doula. And then all of a sudden, within 48 hours, all of our work was gone. So no time like the present. And that led to me training as a doula. So yoga for me was a very important pathway for that. But I also had a really rough recovery physically from my first. I had a really precipitous labor, a really precipitous birth, 8 minutes of pushing for first time mom. Ooh. Sounds luxurious.
No, that's hard.
A lot of damage to my pelvic floor.
Yeah, it's so hard. I talk about that so often because I'm like, it sounds lovely in theory to be like, I pushed for 8 minutes. I'm like, ooh. I mean, my face automatically was like, oh, your poor pelvic floor.
Yeah, I mean,
the reason babies come through slowly.
Yeah, I broke my tailbone. I had severe nerve damage. None of which obviously was caught by medical staff, despite me mentioning that I was having a lot of pain in my tailbone area and in my back, and they chalked it up to an epidural, which I didn't have. I had to keep telling them, no, I did not. No, it's not from my epidural because I did not have one. And then of course, but then they were like, whoa, strong lady, and totally forgot about my complaint. So, that's a whole other can of worms. But the point is my recovery was very long.
Yeah.
For me, I had a hypertonic pelvic floor. So you hear a lot about pelvic floor weakness. Yeah. And a pelvic floor that's too slack. Mine was actually too tense. And that led to urge incontinence, that led to painful intercourse, that led to a lot of physical problems in healing for me. Yeah. So that's what got me interested in the pelvic floor thing, because then I went to a pelvic floor physical therapist. Thank goodness I had insurance that covered it. I know that not everyone has access to that. It should be standard care for people in the perinatal period. Yeah. But yoga was a really good pathway for me in connecting to my pelvic floor, reconnecting to that area, and being able to connect with those muscles and heal those muscles. And again, when it comes to pelvic floor yoga specifically, it's not just for people in the perinatal period. Yeah. Often see a lot of pelvic floor issues with menopause or unhealed pelvic floor trauma, especially in people in the generations that came before us. Pelvic floor therapy was not a thing. Right. And the idea of peeing yourself after having a baby was very normalized. Yeah. Still is. Yeah. Sneeze and pee. Right. It's like a running joke between moms almost, but no, that's not normal. It's common. Yeah. But it's not normal. Right. Yep. And it can be fixed. It's something that can be worked on. Doesn't require surgery usually. Yeah. So pelvic floor yoga aims to simply reconnect the practitioner with their pelvic floor muscles, which has a lot to do with how you breathe. Yeah. And we try to address it in a way that can both strengthen the muscles surrounding the pelvic floor. So your abdominals, your IT bands, your glutes, those muscles, so that the pelvic floor is not doing so much work to basically pull all the weight. Right. Literally. Yeah. You want strength and flexibility in all of your muscles. And of course, I'm not a pelvic floor physical therapist. And pelvic floor yoga is not at all a replacement for a qualified and trained physical therapist. Yeah. But what we can help with is at least identifying whether the pelvic floor is too tense or too slack, And then also just strengthening the muscles surrounding the pelvic floor to relieve some of that effort.
Right.
That's going on that can be causing that incontinence, that can be causing that pain.
Yeah. Yeah. So is pelvic floor, like yoga for the pelvic floor, is that a specific class that's separate from other, like for you, right? Do you offer that as a specific class, or is that something that's like in with postpartum yoga?
Both. So I'm actually about to start offering these classes. Okay. This month we're starting up a postnatal yoga class at Wheelhouse Yoga in Clifton. Mm-hmm. And soon thereafter, we haven't set a date yet, but I anticipate it'll be in the next couple of months. We are going to be starting a separate class that is yoga for the pelvic floor. And so that way we have something that's specific to the postpartum period. Mm-hmm. For people to practice, reconnect, and then also get community in that way. Yep. And then we're also going to have a yoga for the pelvic floor, because once we mentioned postnatal yoga at this studio, the clientele there is a lot of moms with older children. And they were like, could I come to that? And of course everyone's postpartum, but we started seeing a need for something separate from the postnatal class to also address these issues. So the hope is that we will have the postnatal class, and then we'll also have a yoga for the pelvic floor class.
Okay. Awesome. Yeah. So, I will put all of your class links. If you send them to me, I'll put them in the show notes so that people can check them out. Do you have any virtual options for yoga? What are your thoughts on that? Because I know in the last 2 years we've had virtual everything, but also because I have clients sometimes that are still really not wanting to do in-person things in the midst of just, everyone's comfort level is different right now with COVID. And so do you have anything like that, or do you have any thoughts on virtual versus in-person yoga work?
Yeah, actually, we had that discussion when we were talking about starting up this postnatal class. Mm-hmm. We originally were going to start it up, I think it was in March was when we were originally going to start it. And then Omicron was like sweeping through, and it became we postponed it because it became really clear to us that people were not ready. I was going to the homes of postpartum people as a postpartum doula, and this pandemic is not over for people with children under 5, and it's really not over for pregnant people or people with newborns.
No, not at all.
We're still very, very much in that Groundhog Day, trying to protect our kids. Yeah. And I get it. I have a 9-month-old myself. And we went through our own decision-making processes with everything. So I did discuss this with the owner of the studio, and we did decide that we're going to make a virtual option available. Okay. Because it's clear, like, people do want in-person, like there's people who want the in-person, they want the community, but then there's also people who want that, but they're not ready to get out.
Right.
Yeah. So we are going to be offering a virtual option for the postnatal.
Okay. Perfect. Yeah. Well, and I think, one of the things that I am always considering as well when I'm talking about resources is that I grew up in Kansas, and there's a way different level of resources than here in the DC area, where like you can do all sorts of lovely things in the DC area that you don't have access to in smaller communities. And so, whenever I can put links and information about virtual services, I try to do that. So
totally.
Yeah, so we should wrap up, but it was so good to talk to you, and I could talk to you about lots of other different topics.
I'd love to do that.
Yeah. Thank you so much for being on the podcast, and I will make sure that all of Jaely's information is in the show notes so that you all can connect with her if you'd like to. Jaely, it was so lovely having you.
Having me.
Yes, of course. Thank you for all that you do for postnatal and pregnant folks. And I hope you have a lovely rest of your day.
You too.
All right.
Edited and produced by Jaely Turner, as I'm sure you can probably tell. And our amazing music is credited in the show notes as well. So we look forward to seeing you on the next episode. And in the meantime, have wonderful and consent-filled births.